has had a spike in COVID-19 cases. At the end of the Easter weekend, the province had 13 new cases a day. By mid-April, this figure was up to 20 cases a day. Now, joining us for more on this is Eastern Cape Health Department's Sibongile Zungu. A very good afternoon to you, Sibongile, and thank you so much for your time. Does the province have, a handle on things now that we've seen the spike after the Easter long weekend? Is there reason to be concerned?
At this point, we do have an increase in the number of cases, albeit in small numbers, but we are concerned. The main reasons for our concern is that the increase in the number of cases is coming along the route of Sarah Baartman, Nelson Mandela Bay Metro, and Buffalo City Metro. And that is a cause for concern because that route and that trend is what we have seen at each of the waves that we have had. But the numbers at this point are not, have not increased in terms of the number of active cases that we have to an area where we have to place the province on alert.
So, of course, the cases started about 13 a day, spiking up to about 20 a day mid-April. Is there perhaps a feeling that situation might worsen, or do you feel that because you've caught it now, and the concern is, of course, heightened now, that it will be kept under control?
We feel that we will keep it under control, more so because we have active case management at this point, and also we have active contact tracing that we are doing to try and contain the spread of the infections.
Has there been any engagement at national level with the health minister? Because, of course, he himself did express a bit of a concern, that numbers have been spiking. What is the discussions with the national government been?
The discussions that we have had, and we're also fortunate that we had a visit from the National Minister of Health on Thursday, the 15th. We had discussions where we were looking at strengthening our contact tracing and the case management, and also ensuring that at all the levels we control the outbreaks that we have, and we haven't had those wild outbreaks that we had before. Also, what was emphasized is that should it happen that the numbers of new infections increase and the numbers of patients needing hospitalization increase, we should ensure that we have sufficient oxygen, and fortunately we have also extended the contracts of the health workers that are assisting us in that regard. What is also important is that we haven't seen a spike in the numbers of admissions at our hospitals. We have new cases, and also the new cases that we are having are amongst the younger generation that usually doesn't end up with hospitalizations.
Zungu, is the provincial department, satisfied with the way this pandemic has been, dealt with in just the recent past? I mean, because obviously there's been a very huge concern that the Eastern Cape could probably be overwhelmed. But is the department happy now that things are being taken care of as they should be, that the institutions, facilities, health facilities are handling everything as they should?
We are reasonably happy with the efforts that have been made at this point and this time around, and everybody is quite alert, and we are addressing the issues of the COVID-19, whilst at the same time we are getting ready for the vaccination on the other hand. So the amount of work that is being done is quite promising at this point.
Zungu, thank you so much for your time this afternoon. That is Sibongile Zungu, of course, from the Eastern Cape Health Department.